Thanks for joining us for our live event today. We are thrilled to have with us Dr. Ed Kusek, who is one of only 24 recognized course providers for the Academy of Laser Dentistry. Thanks for being with us today.
Well, thanks for inviting me.
We said you're one of only 24 recognized course providers. What does it actually take to be a recognized course provider with the ALD?
Well, there's a series of steps that you have to do in order to get that position. First of all, there's maybe like a basic proficiency course that you could take. It kind of gives you a little rundown of different types of lasers and things. And then there's the standard proficiency course where it's actually like a day and a half of training into there where you learn about all different types of lasers, get to do hands-on training with that. And then you have to show your proficiency on use of an actual system into there too, and pass that with an oral examination, and then there's a written examination afterwards that we've had psychometrically analyzed into there, so the questions are supposedly fair and everything. After that, after you get a number of hours with the ALD within laser training, you apply for the fellowship recognition, and then after that, a number of more hours into their hands-on training and stuff, you could apply for the mastership. And then after the mastership, then if you wanted to start teaching within lasers dentistry, there's a series of PowerPoints that you have to put together to kind of explain to some of the, learn about laser dentistry, all the different types of lasers, all the different types of procedures into there. You submit that to a group. They critique it for you and let you know what needs to be changed and whatnot, and then if you're approved, then you get your recognition.
That is an intense process. I think it's fair to say we're in good hands learning about lasers from you today.
Well, I'm just a CE junkie, and I like to learn.
I think everybody watching this today is probably a CE junkie, or they wouldn't be watching.
True, yeah.
The great thing about being live is you are welcome to send in your questions. I can read them up here on the screen, and I will feed them to Dr. Kusek, and he will answer anything that you, well, not anything, I'm assuming. Right?
Anything that
you
I know.
Have some secrets. I don't know. So let's talk about laser physics to start with.
So laser physics, basically, you know, what you need to have, you have your laser into there, but a laser has to have like a little cavity. So I tell people, think of a shoebox, and inside the shoebox there's an active medium into there, and which is some types of atoms into there. It produces what's called photon inside the shoebox into there. So those are bouncing back and forth. So those are the photons that the laser is producing into there, so we need to have a system then to get it out. So on one side of the shoebox there's a partially mirror into there where some of the photons will be released when you hit a foot pedal, and then you have to have a delivery system with a handpiece to get that out into there. So that's basically the makings of a laser into there for you.
I see some comments already. There's some friends from Australia who have joined us.
Oh.
So, good day.
Good day, yes.
I know it's early in the morning for you. We appreciate you joining us. I have also seen a comment that there's no sound. So if someone can hear, please comment. If not, we're going to keep going because maybe it's just the one person's computer. Talking about the photons bouncing around in the shoebox leads me to think about the different types of lasers that there are. Can you tell us the types of lasers that you use in your practice?
We have several diode lasers, which many people think of as the entry-level type laser into there, basically because of the cost. And the diode laser is only going to cut soft tissue. We have an erbium laser in our office into there, so that will cut hard and soft tissue. And then we have a CO2 laser, which in the CO2 that we have cuts hard and soft tissue also. Some of my hygienists utilize the diode lasers. In my state, they could perform procedures with that. So each laser has a specific use within my office.
And I think what makes each laser good for different situations is the chromophore aspect, right? Well, you explained.
Correct. Well, the body has 4 different types of chromophores into there. You have water, carbonated hydroxyapatite, melanin, and hemoglobin into there. So a CO2 laser basically is going to interact with the carbonated hydroxyapatite and water into there. So if you're doing maybe some troughing or you're around a tooth into there, you may want to shy away from, even though it'll do troughing into there, you may want to shy away because it'll interact with the tooth structure into there.
And that's what you talked about before, you could get pitting, correct?
Correct, pitting into there. So if you're taking an impression, we want to have a nice smooth impression into there. So we don't want to have jagged areas within that prep.
Now you mentioned troughing. I know there are a lot of dentists who do troughing prior to taking an impression, but there are many who just use a hemostatic agent. Why would you choose to use a laser for troughing as opposed to just using a hemostatic?
Well, I always want to do things in my office that's going to cause my patient the less amount of pain. It's going to be more efficient for me to utilize into there. So after doing a crown prep on my wife, she told me never to ever use a cord on her ever again. So there had to be something better to do. So with the laser into there, I could expose my margins into there without having to pack that cord, which causes a lot of pain into there. And we could cause less bleeding because normally when you remove the cord, you're going to get bleeding into that area.
Unless you're using viscostat.
That's true. Yeah, scrub and rub.
Scrub and rub, exactly.
Yeah. So, but the time factor into there too. So we could trough around into there, have a nice area to go. So, you know, my time factor means a lot into there too.
Time is so important. You know, we had another Facebook Live event with Dr. Jamie Morgan, and she said she found in order to just keep the practice running, she needed $2,500 a day in production. So with an 8-hour day, that means $5.21 a minute. So there's your time. Like, time is money in a very literal sense. So the laser can save you money in that way.
Correct. Yeah. So we want to do a procedure. Well, the patient's not going to have discomfort into there, and then we can get the procedure done as quickly as possible because people just don't like to be in the dental chair too long.
Sure. I think you have a video to show also of troughing, correct?
Yeah, we'll show this video into there. We're doing the Gemini dual wavelength into there. And so when I'm doing the troughing into there, I like to maybe not necessarily touch the tissue into there. I like to just touch it and move away a little bit, and it's just a nice paintbrush into there so we could see the margin, covering it around into that area. Just cleaning it off into there. So again, time-wise, you know, you're looking at maybe taking me about 30 seconds to do this procedure. And then
Look at that impression.
Yeah.
Clear margins.
Right. And that's what all labs want to see from dentists.
All labs want to see the clear margins.
Right.
True. That looks great. Should we go ahead and show a troughing procedure?
Sure. We could go ahead and do that.
Let's do it. I'm going to bring this over here. We'll gown up. Go with hands-on right here. Okay. So we're using the Gemini laser today. Can you tell us what you like about this unit compared to other diode lasers you've tried?
So the micropulsing really mimics a lot of more expensive types of lasers into there. So we're getting a minute amount of pulsing into there and gives the tissue enough time to rest into there. So that seems to be the key. Otherwise, if you could compare it to other areas where they don't do the micropulsing into there, it tends to necrose the tissue into there and then creates a lot of discomfort for the patient. And less healing time into there. So what I've noticed is faster healing time compared to some of my other CO2 and erbium-like type lasers into there.
And what you brought up there with the rest time, this is thermal relaxation, correct? Will you explain the concept of thermal relaxation?
So if you have a target tissue, some tissue into there, and you have your laser interacting with that, so we don't want to keep cutting away into that area. So otherwise, that's when you see a lot of necrosis within the tissue. We talked about electrosurges into there. and the amount of damage that it does. So the studies have shown that cutting with an electrosurgeon into there, you could actually necrose the tissue at 1,500 microns, whereas some studies show with some of the lasers into there, they're only necrosing at 5 microns
Wow.
into there. So
That's dramatic.
comfort.
Let me come over here and I'll hold this up for you.
So
Now this laser has some presets on it.
yes, and we kind of programmed something into there.
Dual wavelength active.
So
Dual wavelength standby. Dual wavelength active.
all right. So it does talk to you too.
And it looks like something from a sci-fi movie.
Yeah, patients do mention that
Yeah.
into there too. So
You look like a really high-tech office if
That's
you've got
right.
this.
So we're going to do a little bit of troughing into there. I don't, if the camera is okay into there. So I always like to make sure that the laser is going to be active, but
Voice confirmation disabled.
Now it says standby.
yeah. Well, let's maybe go to another video or something like that, and we can
think
get
you
back
had-
to the hands-on.
I think you had one of a tongue-tied baby, if I'm not
Yes,
mistaken.
yeah. So, you know, one of the things about when you're working with lasers into there, maybe some of the things you would refer out to not do into there. There's something that we could increase the value for the use of a laser into there. So that was one of the things that I got into, you know, virtually by accident into there. I have done a lot of stuff with lasers into there. And a lactation consultant contacted my office, and pretty much she looked me up and begged me to do something like that. And I was like, well, you know, we're so busy in the office, I really didn't have time for any of that stuff. And after coaxing with me, we decided to do it. And we did one case into there, and well, my staff is all females into there, so everybody loves a baby.
Right.
And for me, when I did the procedure into there, I saw immediate gratification. The mother was happy, and the baby was able to nourish. So some of these cases, the baby isn't able to nourish correctly into there, and they're losing weight and things like that. And the mother isn't able to nurse the baby because it causes her so much pain. And so, in that regards, then the mom isn't able to bond with the baby, and then they may need to do some bottle feeding, and that's not the whole process of what we want to do there.
Certainly. Well, if a mother chooses to nurse and she's not able to nurse, that's emotionally difficult. I'm a mother myself, and if that's the direction that you've decided you want to go and you can't, but this is something the dentist can fix with a quick laser treatment.
Yeah, and the thing I like about, especially with the Gemini laser into there, we could cut it, and the thing that most even pediatricians are afraid of is the bleeding factor into there. They don't want to touch any lip frenectomies
Right.
into there. They'll only take a little scissors and snip a little bit into there, which they're not doing an adequate job into there.
Let's show the video.
So this is a case where the patient came in, and because they were severely lip tied into there, the mother wasn't able to be able to brush the patient's teeth correctly into
Wow.
it, and thus
It was causing the baby
decay.
pain
Yeah, well,
to brush the teeth?
And the earlier slide into there, you saw that all the amount of decay. So in this case, we because the patient was so tiny, we took him into the surgical suite under general anesthesia, and we did the restorations, and then we were able to release the frenal attachment into there. So you could see we're kind of tapping at it, and it's what I say when we do this procedure, it's kind of like a seamstress. You're just kind of freeing up the tissues into that area, into there, and just kind of unraveling the whole area. And you want it to make it look like a diamond pattern, and then also I'm releasing that really heavy cord of tissue into that area.
Creating the diastema.
Right, and again, we could see that there's no bleeding
Right.
into that area, and this is 3 weeks post-op. So you can see within that short period of time, the teeth have come back into order.
Amazing difference. Now it looks like we have our laser good to go. The problem was we actually had 2 foot pedals down there, so
That happens.
that was the problem.
So do we want to do
let's
this
try
other?
again.
Do you want to do this other case, and then we can go?
We can do that.
Yeah.
Let's do that. So we'll show one more video.
So in this case here, tooth number 8 is the site that the patient actually came into my practice, and the tooth actually rotated around 120 degrees around there. So it was causing some tissue irritation, and obviously it's not convenient for the patient into there. So we had to find the correct implant that was placed into there. Then we had to find the correct component parts. So in the meantime, when I'm looking at the patient into there, I said, well, your aesthetics isn't very pleasing into there.
Completely asymmetrical.
Right, and the patient was actually, a minister out into there. So she's in the public eye all the time, and that meant a lot to her once we told her about that. So she didn't necessarily want us to do crown lengthening in there, but if we did a little bit of aesthetic crown lengthening, I was pretty sure that we could make some improvements for her. So again, we were using the Gemini laser into this area. And again, because of the micro pulsing into that area, we're able to not create a lot of necrosis into it. So I could actually remove tissue at the time, and then take the impression at the same appointment into there, saving time into there, and then being able to place the restorations into that area, and know that we're not going to get any tissue necrosis or shrinkage of the tissue into there. So first thing we did was we sounded to make sure we had adequate amount of tissue, and we had about 4 millimeters, so we could take off, in this case, 2 more millimeters of tissue into that area. And then we were using, again, like we talked about, a little bit higher energy level, and then not necessarily always touching the tissue, but just kind of melting the tissue away, and then kind of stand back and see where we needed to go from that point on. But you could see, we're measuring the tissue heights into that area. Mm-hmm. You could see the 1 crown margin from the previous restoration into there.
You just got a coping on.
That was, for the implant into there. So the margin around the number 9, you could actually see that. So we're moving that margin down a little bit further, so it kind of mimics what 8 looks like into there. And then we're just kind of contouring that whole area back into the realm into there. So a very simple procedure, and then cost-effective wise, we're looking at charging the patient maybe around $300 per tooth for some simple procedure like that. That's only taking me maybe a minute to do into there.
Wow.
And then the final results.
That's
so
beautiful.
It's
That's
close.
A night and day difference.
Yes. So the
And
patient was
there's-
happy.
There's such an emotional impact to this kind of thing. A person's smile is such a major part of their self-esteem, and it affects the way they interact with other people, whether they want to smile or not, based on how they feel about it. So this is such a great service in the altruistic sense, thinking about the emotions of the patient, but also there's plenty of things we can do with the laser that you can bill insurance for.
Correct. And honestly.
Let's
All
try
right.
hands on again with the correct foot pedal.
All right.
Okay.
So we're trying to get on our safety equipment.
Feel a little like I'm on Men in Black, and you're about to flashy thingy me.
There you go. Since we are live,
You mean otherwise you wouldn't wear gloves?
well, I would wear gloves, but I'm a little helter-skelter. So, we got the correct foot pedal, and this is active. Very good. So that's the first thing I always want to do, is make sure outside of the patient's mouth that the laser is actually working into there. So we're going to do one of the things that most people think about with the laser into there. So we're going to do just a little bit of troughing into that. So am I okay with the camera there?
Yep.
Great. So again, it's just kind of a paintbrush technique. You're just kind of sliding it across. You don't want to do crown lengthening, but what we want to do is just kind of exposing that crest of tissue into there and just kind of gliding around the tissue. So within just a few seconds there, we could expose more of that tooth. Another thing that many people don't utilize into there is, again, when we talked about the frenectomy part into there. So we've got a nice frenum into that area. We want to pull it nice and tight. And so again, kind of like a seamstress into there. And what I try to do is kind of just a little tapping into there and allow the tissue, the laser to interact with the target tissue and moving it back. And then keeping it as tight as possible. And you can see it's just kind of like a seamstress into there. We're unraveling all those little ligament attachments into there. And since this is a pig, you're seeing more black than we normally would see in a human into there. And you can see the nice thing is we could be able to do this procedure without post-operatively placing any sutures. And the patient has less post-operative pain with that.
Let's talk about anesthesia.
What we normally will do in a case like this, we'll give the patient some topical anesthetic, and we'll, if we can, if it's a patient over 1 year of age, we'll try to let that set there for maybe about 3 minutes. And then I will give them just maybe about a quarter cc of local anesthetic. So that way I know everything is nice and numb into there. So then when I tell the patient that the hardest part is over, it truly is the hardest part is over. So then when we're doing that, as shown in that video, you kind of see a diamond pattern opening up into that area. Is there?
Is that all we're going to do?
I think so.
Okay.
Say goodbye to the pig.
You mentioned to me earlier, you mentioned to me earlier that with a laser, it kind of opens up possibilities for dentists to do procedures they wouldn't normally do. So you had the laser, so you started treating tongue-tied babies.
Right.
You became famous for it somewhat, that people travel to you for it. What are examples of other procedures a dentist might do that they wouldn't be able to if they didn't have a laser?
A lot of dentists, anything with blood, they get a little bit worried about into there. So one of the things, if you see fibromas, any part of the patient's mouth, the papilloma, things like that, with the laser into there, we could remove those things really simply, no bleeding into there, send it off to the oral pathologist and, get a report back for the patient. So again, we're doing a service to the patient, removing something because the patient has a trust factor with the doctor that they're seeing into there.
And going to a specialist, it's a whole new person. They don't know this person. They don't trust this person.
And the anxiety level goes up with that too. Into too. So all kinds of soft tissue procedures that maybe you're giving up into there that you could do into the practice.
We have a question. Marco asks, in which cases do you use single wavelength 810 980 instead of the dual mode?
I really like the dual mode the best. I think for the speed of cutting into there, the way they designed it, I'm personally just always using dual wavelength into there.
Great. You were talking before about the portability of this unit. Can you expand on that?
Well, yeah, there's another number of doctors may have multiple offices into there, so you don't want to have a really cumbersome machine that you have to haul around into there.
From operatory to operatory.
Correct, into there. And then some of the lasers into there, the more you move it around into there, it may affect it into there. Well, this machine will actually recalibrate itself every time we turn it on.
Oh, wow.
So many companies don't have that for
This
you.
also has disposable tips.
And that's, again, another time-saving factor into there. Some lasers, they have a glass rod into there, so that you have to actually cut the glass rod to the correct length into there. And studies have shown that the blood could travel up that glass rod up to 10 millimeters.
Oh, wow.
So if you measure this, you know, all the blood is going to be contained within that area, so we're just putting that into the sharps. So. And it's easy to bend into there to get it to the right angle. And it's easy for the staff to actually screw it into place. So the transition time to use it is very quick.
And this is magnetic back here.
Nice little holder.
Nice.
Yes.
Yeah. So it's not, when you're moving it from operatory to operatory, it's not going to fall down and bump into anything. It's a nice little feature. Okay, Ashley asks, how do you know the output to set the laser at if you're not a seasoned laser user? Is there an easy way to know?
Well, yes. With this machine, they pretty much, I don't know if it shows up into here, but when you activate it up, it's got a number of different functions that you could actually, so there's the procedures into there. So then you could scroll. If you want general dentistry, it mentions a whole bunch of different ones. So it pretty much cookbooks it for you. Ortho, hygiene procedures into there. So you just have to scroll the laser to the procedure into that, and then you could scroll down to the one you have, and it sets it all the way for you. So fairly simple.
That's great. Well, I haven't had any more questions come in, so this will be your last chance to send in questions for live. Of course, if you have questions later, do go ahead and leave them in the feed, and we will respond to them after the fact. This recording will be available afterward, and we will keep up with responding to your questions. Thank you so much for joining us today out there to our audience, and thank you so much, Dr. Kusek, for joining us.
Again, thank you for having me.